breast augmentation is one of the most common operations that we perform in Cyprus. When we do the breast augmentation, all the products that we use, all the silicones, is coming from the United States, which is FDA approved, Food and Drug Administration approved. So it is high quality, this is the most important thing. Second thing, when you look at the mirror, the main thing that we and you choose to have the breast augmentation is the medial and the upper fullness. So you will have a more natural and beautiful result. Even if you are not using a bra, you will have the medial and the superior fullness. This is very important. There are two common areas that we use for the incision of the skin. One is the periareolar area, second is the inframammary fold. So whenever we choose, we always use the aesthetic sutures, so you will have a very thin scar. The second thing, it can be above your pectoral muscles or below it. So when we see you, we can discuss together which side that we should perform. So the important thing is that you will have the good medial and upper fullness. So when you look at the mirror, it will definitely look natural and in proportion with your body. The important thing is that it should be realistic, the expectation should be realistic. So we always choose the biggest size that will look natural to your body. It's not the biggest prosthesis that we can use. We have the sizes, so we can decide, we can use in the operation. We use a smaller one, bigger one, and much bigger one. So we can decide in the operation table which permanent silicone that we can choose. So when you get out of the operation, there will be some swelling. But at the end, when the swelling is gone, you will have a beautiful and natural looking breast. If, for instance, if you are having the operation tomorrow, we have to have all the blood tests. You have to quit aspirin or any blood thinning agent at least 7 to 10 days before the surgery. So if you are going to have this breast augmentation operation tomorrow at 2 o'clock, it means that you can wake up at 7 a.m. and you can drink or eat anything you want until 8 o'clock. Until 8 o'clock in the morning, you cannot drink or eat anything. So at 1 o'clock, 1 hour before the operation, you have to be in the hospital. So I will see you there again. We will take the photograph. I will give you the informed consent and we will do the drawing. It's very important. And during this time, you will have the opportunity to ask your questions again. Because most of the patients, they forget to ask the question in the first and second visit, and they always have a question to ask. So it's a very good opportunity for us to discuss. The breast augmentation will go for 1.5 to 2 hours. So, but when a person is waiting for you, she or he has to know that they have to wait for another 45 minutes. So when you get out of the operation, you will just get out of the operation with a sports bra. We will not use any drain at all. So you will stay in the hospital maybe 1 day, maybe less than 1 day. So next day I will see you and you can discharge. Then 3 days after the operation, you can have a shower without any problem. When of course, when you are going to the bath, you will look at the mirror and you say, okay, one side is bigger than the other. So what is the reason of that? So the prosthesis, the silicones that we use, always symmetrical, but the swelling is never symmetrical. So one side might look bigger than the other, and of course your breast might look much bigger than you expected. But within 4 to 6 weeks, which is 1 month, 1.5 months, the 85% of the swelling will be gone, which is, you will definitely like the result within 1 to 1.5 months. But if you want the full results, all the swelling will be gone something like 6 months later the operation. So if you are going to have the operation, don't expect to have a perfect result within 3 days. You might need to wait a couple of weeks to have a good result for that. For the early period, the only important thing that you have to know, you will not have too much pain. Of course, you might have some tenderness for the first 3 days. The shoulder movements, moving up or carrying a child or something like this, you have to be careful about it for 10 days. So you cannot have this operation and when you go to your home you can continue your routine life as it is. It's not possible. You have to wait for 3 to 10 days, so most of your swelling will be gone and you can move your shoulders more easily.